Hi, okay, Dr. Gary Ordog in the Golden Ears Forest and Park, and I'm presenting on this nice day surrounded by wildlife and the natural biome of British Columbia, Canada, and the unfettered forest and beauty of this area, including all of the bugs. So excuse me while I shoo them away. But okay, my lecture today is, should Canada restart its vaccination program? And I have strong feelings about this as a physician and current resident of Canada, and being born and raised here, but working most of my professional life in the United States. So anyway, my points are, there's a low rate of vaccination in Canada, and currently I believe only 3% of Canadian citizens have been fully vaccinated currently. I personally note it is very hard to get a vaccination here in Canada compared to for example, the United States, even though that's probably not a good example because they had a major initiative going early on to support the production of vaccinations. But I do note I've only had my first shot here, and I have to wait 4 months for my second shot. I did receive the Pfizer shot, so that is good. That's a messenger RNA shot vaccination. But let me say that I believe it was late September, I received my notice from UCLA that my shot was ready next week. So I could have had it probably 7 months ago, 8 months ago. My first one, and then 3 weeks later, my second one. But anyway, I couldn't cross the border to get it. And so I had to wait for the one up here, which just happened about a month ago now. I have to wait 4 months for my second dose. But serendipity, thaumaturgically, whatever you want to call it, in the meantime, they found out that if you wait longer between your first and second shot, that they've tripled the antibody levels. And so maybe it's a good idea to wait. Okay, anyway, they don't know what that equates to in clinical outcome, but in laboratory, the triple the antibody levels is probably good. Hopefully they're the right antibodies. But cell-mediated immunity is important in viral infections, and that involves T cells. So this says nothing about the T cells. The B cells produce the antibodies, and perhaps that's not a big factor in fighting off this virus. But that we don't know exactly yet. Excuse me, bugs are getting me. Okay. So, hard to get the vaccine. Now, I know the government has had to beg other countries for vaccinations, including from the United States. Fortunately, we were lucky that we received vaccines from the United States to help out. But I'm really worried about getting a second dose. And now there's questions whether can I get a different vaccine, and is that useful and maybe even beneficial? So we're trying to investigate that at the present time. Okay, again, the previous president was nationalistic, didn't want to give away vaccines. The current president is more globalist and sees himself as a citizen of the globe and not just for American citizens. And he has been giving away some of the vaccine to other people other than Americans. So that's good. That was apparently the only way Canada was able to get some vaccine. And as far as I know, a lot of my family members only received vaccine that was donated by the U.S. government. So anyway, that's interesting. Okay, anyway, again, this is all my opinion, and it's not related to anybody else's opinion, and it's just based on what I read and analyze, and it does not represent any government agency or other person. Okay, now we should get back to production in Canada. The problem is Canada stopped producing vaccines. And production of vaccine turned out to be important in this pandemic and is probably going to be important in the next pandemic. And there are going to be more pandemics. And they're probably going to be worse than the present one. Just from knowing history, okay? If we get back into production, then we can be better prepared. Let's say, for example, something happened and we weren't able to get any vaccine from other countries, then we would be really out of luck, to put it mildly. And I assume there are many other countries in the same shape. Smaller countries with less budget. I believe our government pre-ordered a bunch of vaccines from other countries and paid a large amount of money as far as I heard, but again, I'm not in the loop there, so what I say is just my opinion. So Canada is, I think, suffering right now. Our infection rates, death rates are higher than ever. Vaccination rate is low. The only way to stop this is to vaccinate and get vaccination herd immunity rather than the natural herd immunity. Okay, so the next pandemic will be worse. And if we don't make it ourselves, we may not have any vaccine for the next pandemic. So the scenario of a bad pandemic, as a give from the hemorrhagic Ebola, let's say with a 95% mortality rate, a nationalistic U.S. government not willing to give their vaccines to anyone else could cause a huge mortality in Canada if we were not able to produce our own vaccines here. Bad news for Canada. Okay, so if anyone's listening that has any influence in the Canadian government, please start producing vaccines, government-controlled programs of vaccine production that aren't dependent on big profits for companies and aren't guided by big profits for companies and swayed into corruption, etc. But able to give us vaccines in the next pandemic without having to beg, borrow, steal from other countries and neighbors. Okay. Again, my opinion, not the opinion of anyone else, and just presented for educational purposes. So, Okay, anyway, the serendipitous part of this and the thaumaturgic, you might say, part of this scenario is that it looks like probably my antibodies have tripled, waiting for my second shot of which I happen to get the messenger RNA, the Pfizer vaccine, which again is probably a good thing. I mean, hopefully it doesn't lead to excessive antibodies and autoimmune disease. But right now, in preventing and, well, at this stage, preventing because I haven't had COVID-19, but in the prevention of contact with the COVID-19 virus, then I would hopefully be better protected than if I'd gotten my second vaccine as directed 3 weeks after the first. So that might be called serendipity or fortunate circumstances that just happened out of luck or not out of planning, because it definitely was not planned that way. Okay, anyway, Dr. Gary Ordog doing a nationalistic approach for a Canadian vaccine is recommended to help prevent disaster in the next pandemic of a virus. And again, I used a specific example of Ebola, hemorrhagic fever, 95% mortality rate, compared with COVID-19, way less than 5% mortality rate. Okay, my advice, get your vaccine. Canada, start producing vaccines again. And stay healthy, wear your mask for now, and maybe forever. Okay, some people don't like that, but you know, it will also help prevent the flu and colds and other diseases from being transmitted. Wash your hands, Semmelweis syndrome. Wash your hands, use hand sanitizer, maybe gloves, and stay safe, eat well, exercise, get lots of rest, enjoy your life, be happy, and have a good life. Okay, thank you, Gary Ordog signing out. Please sign up for a channel, Gary Ordog, and thank you for your support. End of dictation.